Stop. All right, good evening, and thank you all for joining us. I'd like to call this meeting of the Pitt County Board of Health to order. And first thing we need to do is approve the agenda, which you have in front of you, and I'll let you know that the highlight for the Ecom for Change, we're going to move that to June. Otherwise, the agenda is as written, and we'll accept a motion to approve the agenda.
So moved.
It's been moved and seconded to approve the agenda. Any discussion? All those in favor say aye.
Aye.
Any opposed? Thank you all very much. And we'll start with the highlight. Do I need to ask if there's any public comments? Any comments from the public? Here none, we'll press on. And we'll start with Allison's going to give us a highlight on health education and promotion. Welcome.
I'm going to try to make this fairly quick because it was a busy agenda when I planned. So I'm going to talk to you about the community health needs assessment. And I know a lot of you all know why we do that, but I'm going to just sort of talk about what it is and why we do that. So just one example is I was talking to somebody one day and talking about something we were working on, and they said, well, why are you working on that health issue instead of this health issue? And I was able to tell them that's because we actually do a community health needs assessment. So every 3 years we often call it CHNA. We do this assessment and we take data that we know, right? So we can take statistics and those types of things, but then we also get information from the community members and pull all of that together to see what are the needs in our county. And then from that, we can prioritize. Now, just because we choose to work on one thing doesn't mean another thing isn't a priority. It may be that somebody else is already working on that, and so we don't want to step over each other. But we can all use that information to choose what we're going to work on. So what we're going to do is gather all of that, and then we will choose what we're going to work on for the next 3 years. So let's see if I can advance this. Okay, so this is basically what I just said, but the goal of CHNA is to develop strategies to address the community's health needs and identified issues. So we actually work together, Pitt County Health Department, and many of you have probably heard Pitt County is different, but we actually work very closely with our hospital to do this and have been for years. A lot of health departments are required now to work with their hospitals, or the hospitals are required to work with us, but we've been doing it. This is a long-standing relationship. So this is something that we're doing together, and again, we will put all of this information together. We will present to you all. We will present to the hospital board, and they choose, and you all as well will choose those 3 things that we're going to focus on for those next 3 years. So just in case you're wondering, right now, based on our last CHNA, our current strategies are chronic disease, maternal child health, and mental health. That may change. It may be very similar. It may stay the same. So we'll see when that comes out. So just so you kind of know what we're doing, we partner again, as I said, with ECU Health. So we're working with ECU Health and also Pitt Partners to Health. We're all working together to try to find out what are the needs of our county, and we're doing that through focus groups and through surveys. So some of the focus groups that we're doing for example, that we're responsible for are related to maternal child health. And so we're trying to do some focus groups with some people who really serve that population, particularly some of our staff. And it's not just our staff, it's others as well, but particularly people who go into the home. So they can go into the home and they can say, this is what I see out there. This is what I see people struggling with, so it can really represent what people are experiencing. We're also going to work with child care providers to do the same. Another way that we're getting information is through the survey. So if you see, this is an example of what we'll show on social media. We have them in English and Spanish. We've been sharing these on social media. We ask if you can, if you have the ability, if you could share it on your social media as well. Our goal is around 300. Right now we have about 174, but what it's looking like is we have a lot of white women. So we need some diversity across the board in that. Wes you went to a presentation in Belvoir area and took some of these cards last night. So I can get you cards if you would like, if you have perhaps an office that you can set them in or something like that people could take. You can share them online, as I mentioned before. We could get you flyers if that's something that you're interested in doing, but really getting those out. We do also have paper surveys, so if somebody does need a paper survey, we could get those to you as well.
Yep, and Allison said every week we get a list of, the demographics that have completed it. And you're right, Caucasian females are very high on the list, so we can see where our deficits are and then what groups we would like to reach out to make it a more
it was, I think 174 surveys, and I want to think, I had it printed out and I think I left it on my desk, but I want to think it was 120 something that were Caucasian women, and it was in that 45 to 55-ish range. So, so we definitely need some more diversity there. Okay. And that is all I have. Do you have any questions?
Any questions for Allison?
I don't have it. Excuse me. I don't have a question, but as you said, a lot of people, most people, don't know about the health need assessment. And I didn't know about it until I started with Pitt Partners for Health, and knowing the partnership with them and with the health department. That was when I learned about the health needs assessment. So it is something that we need to get out into the community, that this is what the health department does. It just doesn't, decide which one to work on, what program, what projects, or whatever to do without some kind of survey or some kind of, assessment or whatever, and that we do actually an assessment, to determine some of these things that we do. So we do, judging from your survey, your number, you do need some more diversity, so you need to work on how you're going to get that.
Yes, ma'am. Yeah. And that's, to your point, I think, some people don't think, oh, I'm going to do the survey, but nobody really cares what I think. We have to make these decisions. We have to choose these priorities. So we're going to we have to. So we're going to choose them with the information that we have.
Mm-hmm.
Or we're going to choose them with the information that other people can give us. And so we do want to know what people think. And we do need that information to help us make those decisions.
Yeah.
So they're representative of our county and the needs.
Mm-hmm. Yeah. But, you're going to have to really make some, concerted effort.
Oh, yeah.
To get some more information.
Yeah, and we're working
people
together.
People are just not going to,
The whole team is working together on that. But again, if any of you all are able to share it, that would be helpful as well. All right, thank you.
Thanks, Allison. Okay, next up is Angie's going to talk to us about the fee schedule update. How are you doing?
I'm doing well. How are y'all?
Good, thanks.
So we said at the last meeting that we have, I thought, kind of beat this fee schedule to death, but then the state sent an email and said, no, you can do one more tweak before July 1st to your fee schedule. So that is what we're going to look at today. So please excuse me, I'm going to butcher this vaccine name to death. So my apologies. But this is the call to add the addition of what she said. I'm so sorry, Dr. Garrison, please help me. I'm so sorry. This is an RSV vaccine for infants. So this calls to the addition of the fee schedule due to NCDHHS. We are enrolled in the Vaccine for Children program. And so when we receive the free vaccine that we can give at the state level, free doses of vaccine, NCDHHS has come out and said, if we give you the free vaccine, you must offer private doses of the same vaccine. You'll remember a few months ago, the guidance came out with the change in dose recommending the dosage of pregnant women. This guidance also recommends this vaccine for children, babies under the age of 1. So this is a new vaccine that is not currently on our fee schedule, so I'm bringing this forth to you today. So this is an NCDHHS vaccine for children requirement for providers of the free vaccine dosage to carry and provide the private doses. This vaccine is for newborns and babies under the age of 1 year, born during and entering their first RSV season, and or children up to 24 months of age who are at risk for severe RSV disease. This new proposed fee is for $525. The cost is estimated, our cost, at $520 per dose. And reimbursement currently estimated from NC Medicaid is $509.85, and Blue Cross and Blue Shield is currently estimated at $510. This fee would be effective currently after your approval, and then it is on the Board of Commissioners' approval for their next meeting, and it would be effective currently for the 23-24 year for us to place the order after your Board of Commissioners approval. Yes, ma'am.
Kelly.
So, Nursivimab,
Thank you so much.
I'm guessing here.
Yeah,
Lee?
I'm agreeing with you because you pulled it off beautifully.
How many doses is this like a series or is it one dose?
So my understanding is that it is 1 dose for the baby, is my understanding during that time from our immunization coordinator. From my understanding, so what I have learned is that while we normally see more of the maternal side, so we would vaccinate the mother, and during pregnancy, it is my understanding that the baby actually has immunization. So this would be for a certainly very small population for us, for a child that the mother did not receive the vaccine, the baby was born during this time period, and that would be the baby that would be recommended to get the vaccine.
Got it. Thank you.
It is, according to our immunization manager right now, and talking with the manufacturer of the vaccine, because it's new, our minimum quantity to order would be 10. The expiration dates, while they don't guarantee it, seems to be a fairly long expiration date, and a lot of the manufacturers will give us a credit if we have expired vaccine that we can send back, considering that this price point of the vaccine is extremely expensive for us.
Okay, well, let me understand this.
Yes, ma'am.
This is a new vaccine,
Yes, ma'am.
and will it be required?
It is not required. It is guidance. So if we saw a patient whose mother was not vaccinated and the baby was born during RSV season, or had a medical condition, if he or she were over 12 months old and it was heavy RSV season, and that he or she maybe had underlying medical conditions which maybe made it more susceptible for RSV vaccine, and the baby fell within the guidance of receiving, then it would be an option to vaccinate the child. No vaccine this would not be a mandatory vaccine. Am I correct? Okay. And we at the health department, we don't provide primary care for infants, so this would be a very small population that we would see. We see a lot of maternal care, so where we would vaccinate is more on the pregnant mother. But in the chance that we saw an infant or a family and the infant was not, and we were catching the infants up on vaccinations, and this vaccine fell into that potential.
So your pregnant mothers are that's a very small population too, right?
No, our pregnant mothers would be the largest population that we would see, because we don't provide primary care like a sick child visit at the health department currently right now. We don't typically see children under the age of 12 months.
But I'm
Like a
saying, I'm
lunch.
asking your pregnant mother's program,
Our maternal health program,
yeah, that's a small?
no, that's a fairly large clinical program that we have. Yes,
Oh,
ma'am.
is it? Oh, it is?
Yes, so we actually are we've applied for grant funding for RSV vaccine. So, because we don't know exactly, with it being new guidance given a few months ago to vaccinate pregnant mothers, we just don't know exactly how many vaccines we would actually be giving. So this is kind of new territory for us. So it's going to be interesting kind of going into RSV season, how many pregnant mothers we actually would opt to receive the vaccine. So we'll be able to collect that data going on this year. Yes, ma'am.
You anticipate getting out many more free than you do that you're charging for,
We
right?
do,
Yeah.
we do. The only thing is our immunization schedule is not a sliding fee schedule, so someone that did come in that was uninsured, would not slide to zero for immunizations.
Any other questions for Angie? So a motion would be in order to approve this addition to the fee schedule and to recommend Board of Commissioners approval.
Move to approve.
So moved and seconded. Any discussion? All those in favor say aye.
Aye.
Any opposed? All right. Next up, thank you, Angie, is Wes is going to talk to us about the FY25 budget.
Thank you, everyone. I want to start out by thanking our finance office, Angie and Katie, and everybody that worked on this budget, our friends in finance over the last several months, and commissioners for giving good feedback on what they'd like to see in this budget. And so I think we've got a great budget that addresses all the needs we see in the county and addresses the needs of the health department. As a reminder, last year, fiscal year '24, the revised budget was $20,505,832. A lot of that, we saw some end of some of the COVID era AAs. The budget that we submitted, the balanced budget, was $16,207,764. And then the manager's recommended budget was slightly higher because that includes a 5% cost of living adjustment for employees and longevity pay that starts at 5 years now. Instead of the original 10, it adds a 0.75 longevity payment at 5 years. So that's included in the manager's recommended budget of $16,411,967. The priorities of this budget, we want to meet the community need for clinical and environmental health services and improve the outcomes for our patients and our residents. Examples of that are our new STI clinic. We want to keep that and expand that program, shortening the wait list for maternal health and child health appointments, a Q-list check-in system, the opioid settlement dollars, dedicated diabetes self-management program employee, a WIC staffing coverage, the Pitt stop in Bethel, and then staff development. That's recruitment, retention, and training. So how do we operate more efficiently? We do that by having adequate staffing, filling those vacant positions, professional development, increased awareness of services through branding and advertising, improved technology in our waiting areas, in our electronic environmental health records retrieval system, data mining through our electronic health record, and billing and performance management. So the main overview of the budget, the main changes are 2 new positions that we've asked for. Are 2 new positions for the Pit Stop, and those are going to be hopefully grant-funded positions. If the grant does not pan out, then those positions will not be paid by the county. So those are the 2 new positions we've asked for. Expanded clinical services and community outreach. That's the STI clinic, child and adult health, potentially expanding those programs, and then dealing with substance abuse and the opioid settlement for the county. Staff development, that's recruitment, retention, and training, funds for training, development certifications for professional licensure for clinical staff, environmental health staff, and other staff that need a clinical license to do their jobs. And then technology, so that's a $50 stipend per employee that has to have a nursing license renewed or a professional certification. And then technology, their electronic health record, the Q-list Q system for a WIC, and that can expand to clinic services, Televox for patient reminders, I2I Data Mining, that's a company that we're working with on a pilot project with several health departments to look into our electronic health records and combine those other health departments into a single dashboard so I can compare with Craven, Edgecombe, Albemarle Regional, how we're doing on about 28 different performance measures related to maternal health, child health, immunizations, family planning, STDs. Example, as we do, later on in my presentation, I'll talk about the STI clinic and give an update on that, but that's an example of what we want to see going forward, some additional services to meet those needs. We saw a need to address high STI rates in Pitt County, and we're doing that through this rapid clinic and expanding that program. Some of the high-level changes that we see in some of the programs, administration budget, that has gone down. Regular environmental health, we've seen a decrease in the amount we've had to ask for from the county. Environmental health, food and lodging, we had an increase in state AA funds for meeting all 100 county inspections, so about $72,000. So we've eliminated the ask for the county. Healthy Start, we've had to ask for some additional county dollars to cover increases in that program. The WIC program, as I mentioned before, we saw a major decrease statewide. About 60 health departments saw major decreases in their AA funding for WIC, and so we've had to cover that to continue to maintain staff and to get our caseload back up to the adequate levels. So I've asked the county for some additional funds to cover WIC admin and WIC nutrition. Family planning has increased in county ask for that program. Child health as well. Maternal health, we've gone down in our ask from some of the county funds. And then communicable disease, we've gone up slightly in the request for county dollars. Smart Start, same as well to cover that program. We've asked for additional county funds, and then county funds for our diabetes program to have that full-time staff member. An overview of the revenue pie. So about 60%, 59 to 60% of this budget is interfund transfer county allocation. And that's very good because 86 health departments, we're very, very lucky in Pitt County that the county supports public health and we're adequately funded for our programs. The 86 health departments range for anywhere from about 7% funded by the county. So look at their entire budget, the county only funds about 7% of that, all the way up to the very, very high end. Some counties are about 75% funded by their county. And so what our goals going forward in our strategic planning session and talking with staff and planning the next several years of budgets, we want to grow that pie, that slice of grants, which is currently at about 2%, grow that Medicaid slice, which is about 9%, Medicaid, maximize what we can get from the Medicaid cost settlement, and then that DHHS funding of 24%, that's our AA funds. And we want to make sure that the state, when they look at those formulas that they're allocating those AAs, that we get a bigger slice of the pie, because those have not been updated in some cases for several years, some since the 80s. And so we're going AA by AA in the health directors group and making recommendations to the state for how that can be more equitable and benefit our counties. And also to look at how the pass-through money from block grants comes to the state and then trickles down to health departments through the AAs. The state's keeping a big percentage of those. Like say for our CDC grant, they keep about 60%, we get about 40% in the locals. Immunization AAs, all these different ones, the state keeps a big slice for their programs and gives us a slice. So we want to examine how that happens, what are their true costs, and could locals get more of those funds in the future. So we're always fighting to increase that DHHS piece of the pie. And that is our revenue picture. And I want to say thanks again to everybody for making this process smooth for my first one. And I think we've talked back and forth with our partners in the finance office and come up with a budget that where revenues match expenses. And I think we've come down from last year, and I think it meets all of our needs. Happy to take any questions you might have.
Wes, could you go back in the slides? Just keep going. Keep going. Go back to Healthy Start. Is that a typo?
That's 391,220. It's the same AA as last year. I saw that right before I came up. Yeah, not 3 million. It's 391,662. But we are requesting additional to cover the cost of that salary for those employees.
So could you explain in plain language? So it looks like you're requesting $4 million less. Is that right? Where does all that come from?
So some of these, like say our AA for testing COVID testing, that was about $1.7 million, correct me if I'm wrong. So there's several that have expired over the last year that either expired into this month. So those have definitely gone down. There's about 3 AAs that we no longer have access to. And we have to lower our expectations for for spending those. So that's where that main part of that, that's why it had been revised up to $20 million last year to account for that additional AA.
Are we cutting any programs or losing any programs?
No, not cutting any programs. We're cutting the ask for the county in some programs because we're getting some more in AA
We're not
funding.
cutting any services or
We're
anything?
not cutting any services.
And just for everyone's knowledge, what does AA stand for?
Agreement addenda. It's like a contract, basically. So there's certain ones that we get, say, for vector control, there's food and lodging, there's the lead in schools, there's special ones that the state can offer us and we can choose to take it or not. There's some that only Pitt County gets, like say the CDC Public Health Infrastructure Grant. About 10 regions got that. So Pitt County's the lead in our Region 10 Health Department, so we're the fiscal agent for that grant. Each health department also got an AA called 117, and that's public health infrastructure money. And so each health department gets that, but Pitt County gets AA 118, which is to have an employee to oversee the contracts and grants for the entire region. So only we get that in Region 10. And an agreement is just like a contract. It outlines exactly what we have to do to fulfill that, what reporting we do, and then how much money we get from the state to draw down on our county drawdown system.
Thank you.
Any other questions for Wes? Do we need to approve this or recommend it for the?
Yeah.
Okay, that'd be nice. So a motion be in order to approve the proposed FY25 budget.
I do have a question.
Yes, go ahead, Kelly.
Is there a need for us to vote on that today, considering we're just kind of getting our eyes on it?
How urgent is it?
I don't think we have, no, because the county doesn't approve it till end of June, is my understanding. Is that right? So,
Maybe we have a chance to,
so if you want to
Process
come
it
back
a
in
little.
June and
that might be nice.
absolutely. And any questions you have, send me and I'll get you that information. And I'll get a more detailed explanation of the decrease from the $20 million to.
And then we can circulate it to the entire board.
Great.
Any other questions? Thank you, Kelly. That's a great idea. Okay, next is monthly financial report. Angie?
Okay. So, I sent my Excel sheet to Dawn. She said it was too large to see on the screen, so I apologize for anyone watching. But you have your paper copies in front of you. So this closes out, so you're seeing reflective month end for April 30th. And so, again, just to reiterate that we do have some programs that are going to show in the red that are, they do draw down state funding with those agreement addendums, and you always have to draw down 1 month behind. And so all the expenses from April are actually being calculated, and I will submit those actually and certify those tomorrow. So looking at, you've got your revenues up to date, and I will say this, the impact on staffing, and I won't steal Wes's thunder, but the good news that he's going to bring you on staffing has really impacted what we're able to draw down on our agreement addendums from the state. So we will be actually maximizing a lot of those state agreement addendums down to near zero this year. So the revenue sides are reflected there. On the left-hand side of the column, the green column again is your county appropriations of what your county has contributed to equal your total revenue column there. Again, breakdown of salary and fringe, contractual expenses, operating expenses, and your capital outlays. Your capital outlays this year have been the purchase of items such as your AccuVax machines, the purchase of your 2 expeditions for the communicable disease program. We've been able to also purchase 2 Ford Escapes for the communicable disease program as well, for the disease intervention specialist. So, and all of those have been those state dollars through COVID agreement addendums. So those have been the bulk of those capital outlays there, and they've been outfitted. The expeditions have been outfitted with equipment for the nurses, so they can actually be mobile. And if I'm not mistaken, they actually will have refrigerators and like battery packs and everything like that. So if they wanted to set up a clinic in a parking lot, they literally could and work out of the expedition. So those are the capital outlays there. I will highlight that, so everything in black on the right-hand side is working at a positive, and then every program that is in red, we are expecting to be able to draw that down in the next month through state funding. I don't have any concerns financially about a program. I will point out two small programs in the very, very bottom in tiny, tiny print that you may not know or recognize, and that is because that is on our ledger. And so that is a work in progress with finance of finding out what that $4,000 expense is. It's related to COVID. So that's a work in progress. And then we've taken in a little revenue for epilepsy program. So we have to account for that $60. All total, our total revenue is $12,881,305 through the end of April. And our total expenses are $11,017,354, and we do balance within 2 cents to the county munis report. I could not find the 2 cents. I'm sorry.
I'll make up for it.
I'm rounding up, so we do balance for through the month of April. So right now we are running below total revenue, so we're in the positive.
All right.
So, any questions?
Any questions for Angie?
Okay.
Great report, thank you.
All right, thank you.
Do we need to vote on this?
I
To
think-
accept it? Yeah,
I think we do.
Yeah. So a motion would be in order to accept this financial report.
So moved. Second.
Been moved and seconded. Any discussion? All those in favor say aye. Any opposed? Thank you very much.
Thank you.
Wes, Health Director's report.
I'll mention one thing I failed to mention earlier at the, when you asked about the difference in the 20 million and 16. In the last year with that ARPA dollars, Pitt County is the lead for the ARPA for this region. So we've been distributing that to other health departments. That was about 1.2 million over the last year. So that AA is not going to be there next year. We're not going to have the big COVID testing AA. So those are almost together. So those are two of the biggies
Yeah.
that we're going
Okay,
to
great.
see next year. All right. So I'll start my report. Again, I'll talk a little bit about disease surveillance and then some real exciting news about their HR updates and then some public health highlights to wrap up. We continue to see decreases in respiratory virus surveillance. Again, that's flu, RSV, and COVID. Those numbers continue to go down as they have since the end of December. Again, we're playing around with different ways to display some of the STI clinic data because I really wanted to see, and Thomas Debner's been really good with some of our data presentations. So what you're seeing is from left to right, August through April. How many patients scheduled in that first block, how many patients seen in that first block, how many new infections. So again, we schedule the patients, about 80% show up, but still a very high show rate compared to say 60% for a clinic visit. And then the new infections. So we are seeing, again, we found a lot of infections at the beginning, and then you've seen some fluctuations over the time, but you can see how well attended these clinics are and how big of an impact it's having. Now, say for individual diseases, so abnormal lab result breakdowns, you can see from August to April for gonorrhea, how that's gone up, kind of a curve, and has gone down. Chlamydia is really exciting to see those numbers continue to decline. Trick has been down and then shot back up after the new year. We've had some syphilis numbers, HIV, HSV, HEP, bacterial vaginosis, and yeast. So this way you can kind of see that progression and kind of an impact we're seeing in actual positive cases of something like a chlamydia, where traditionally Pitt County has seen very high rates in the past several years. And then demographic data. Again, to break it down in this way, you can really see that a lot of our cases are African American, Caucasian, and Hispanic, and other. We have more insured patients coming to the clinic than uninsured, which was something that I wasn't expecting, but you see that play out in the data. And then our male to female ratio for who is coming in to get these visits. And then our HR update, very exciting. We have a lot of new employees. We did a lot of interviews since the last meeting. So we've got Jeremiah Moore started yesterday at Nutritionist 2 in our WIC program. Vicki Blackwell will be starting at the end of this month, patient relations. Lisa Felix is a new midwife. She's going to be starting in June on the 10th. Caitlin Wells is our community development specialist 1, and she's going to be working on our opioid settlement grants. And then other positions, a CD control specialist, public health nurse 2, 3, and those other two positions that we're currently have done interviews, but we're waiting to make offers. And then the public health nurse 2 accepted today, so they will start on 5/28. So I think as of once those positions are filled, we have either 7 or 8 vacancies, which is very exciting. So we're in the single digits finally for employee vacancies, which is very good. And then the last day, since Ray Neal, our advanced practice provider, is July 5th, and we're working to make sure we fill that position as well. Some of the highlights of the community, Allison mentioned the community listening session we did last week in Belvoir. Mr. Fleming was there, and we had a good turnout. This is the Human Relations Council put on this event, but I did get up and do about 45 minutes on what the health department does, and then answer questions from the crowd. And we did get some good feedback, about trash and animals, about how long animals have to be quarantined if it's a bite and don't have a rabies shot. So they did have some good questions, and that's an example of what kind of focus group data we want to collect when we go out and do these later this summer for our community health needs assessment. So we did let them know about that, and hopefully we can get some responses from that group and then go out and do an actual information session and just for them. And then we have there's one tonight in Greenville, and then next one is Tuesday, July 16th in Winterville. And then earlier this month, in April, we did the Hoops for Hope event. That was Tiffany Thigpen helped put that on from the health department. Also, me and Heidi Shelton went to WCTI and did a kind of a live news interview about the dental unit, and then they did a stories later that afternoon, and they had a really good story about our unit and a lot of pictures and video and we talked a lot about the past history of the unit and what we want to achieve with it going forward. And then Heidi and I also spoke. We presented at the Eastern District Public Health Association meeting in Atlantic Beach in the end of April, along with several other health departments that do school-based dental. And so, again, still trying to get the word out and recruit us a dentist so we can get back into schools. And that's my presentation. So anybody have any questions, be glad to answer.
Any questions for Wes?
I think 7 or 8 vacancies, outstanding.
Oh, yeah. HR has done a scheduling all these interviews and calling folks back and getting, all the staff from all the divisions have really stepped up and found some great candidates. I'm real excited about the potential of those.
Thank you, Wes.
Thank you.
So in your packet that you received, you had the minutes, right, Lauren? And we'd like to approve those minutes. Any corrections or changes, improvements in the minutes? So a motion would be in order to approve the April minutes.
So moved.
Okay, Chief, it's been moved and seconded to approve the minutes. Any discussion? All those in favor say aye. Aye. Any opposed? Anything else for the good of the order? Because we got lots of time.
No, it's good.
So a motion to adjourn would be in order? Moved and seconded to adjourn. If there's no discussion or objection, we stand adjourned. Thank y'all very much.